Hi, my name is Celestine Hall, and I'm here to present my Task 5 MBA Capstone Competency presentation. First, I'd like to say my purpose in coming to WGU was to pursue an MBA and to formalize my on-the-job training. My focus was on gaining business acumen in strategic planning and management. The 5 competencies that I have developed through my stay at WGU are working with human resources to develop, analyze work and human resource planning, organizational performance methods, budgeting, evaluating feasibility and profitability, and statistics as a managerial tool. I have found these 5 competencies very worthwhile and use them in my Task 4 assignment in multiple ways. The Task 4 assignment for me is working with a health plan to develop a strategy to address the increase in readmission rate. The first competency that I utilized during that time was statistics as a managerial tool. Working with the statistics courses, I was able to identify and effectively use statistics to evaluate alternatives for the decision-making process. In my task, I was able to look at the statistics that were being evaluated, make recommendations for using a different type of data, meaning that we, instead of using authorization data, using claims data to give us more in-depth information over a longer period of time, which would help us to pinpoint and focus our strategy in ways to help reduce the readmission rate. In doing so, we were able to identify that there were 4 primary facilities where our readmission rate was impacted. And the recommendation was to put an on-site nurse at those 4 facilities so that we would be able to get information firsthand and work directly with the patient for discharge planning and strategies to help the member, once they're discharged home, to remain home safely and comfortably. I also used the competency of organizational performance methods and analyzing work and human resource planning to design the job description for the on-site nursing physicians, to develop the training curriculum for the on-site nursing physicians, and to collaborate with human resources on the recruiting and the hiring of the right candidates with the right set of skills for an on-site position, as our positions in the past have all been telephonic. Moving to an on-site position required a different skill base, and we needed to employ different recruiting and hiring skills and evaluation of skills when hiring for those positions. The use of organizational performance methods was very helpful in looking at our overall process for discharge planning and our approach in reducing readmissions, and determining that using a strategy where we did early interventions in the discharge planning, beginning earlier in the inpatient stay and gaining more in-depth information about the patient would help the overall outcome of that program. In addition, using budgeting, I was able to determine the more appropriate budget for the on-site positions, including IT support, the equipment that would be used, parking, traveling, the salaries for the nurses, and how that would impact our department budget overall, whether it was something that was affordable and whether the project was feasible, and finally whether the project was profitable, were skills that were I used as a part of evaluating this project and were gained in the competency of evaluating feasibility and profitability. In using those skills, I was able to determine that placing one nurse on site, including salaries, and as I mentioned, parking and transportation and those things would equate to a $3 million cost savings for the company. So the feasibility of the project and the profitability of the project were demonstrated. Some of the obstacles that occurred along the way were acquiring, as I mentioned, the appropriate data for the project, making sure that we were using claims data that had was more robust, provided more information for our analysis, and gave us the ability to pinpoint what facilities, what population we would focus our attention and time, and what strategy to use in placing nurses on site was very valuable. Getting to the data was a little bit difficult because the company had made some decisions around using authorization data, which is available quicker, a 30-day turnaround time versus claims data, which has a 90-day run out. But was able to convince them the benefit of using claims data was for the more robust information, and certainly you could use both data sets. One to give an early warning using the 30-day window for authorization data around readmissions, but then using the claims data, which is more long-term and has more depth to it, to really identify where our core issue was and focus our time and attention in the right place at the right facilities using the right strategy. The second obstacle was getting hospital leadership to engage in the on-site discussion. In order for the project to work, we needed hospitals who were willing to accept our staff coming on-site at their facilities and engaging more directly with patients. And it ended up that I needed to drive out and meet with the facilities face-to-face before we were able to get the project off the ground. Phone calls and emails were just not effective. So there were two strengths that I developed or identified and developed as a part of these projects. One is research, really digging deeply into statistics, and rather than settling for the obvious, really asking the questions that need to be asked, asking what else has been tried, researching what other companies or hospitals have tried to address the readmission rate. The second is creativity, being willing to consider a different approach to a current challenge, something different than maybe other facilities or hospitals or health plans have tried in the past. And when it's obvious that the information that we're gaining in statistics is not really answering the question that's being asked, I'm really digging deeper and looking more creatively at how to apply the data that we are gaining to get a better picture of what is truly taking place in the setting, the workplace setting. So it really called on looking at the information in a different way. And finally, the most significant lessons that I believe are learned and why these strategies would be helpful, why creativity and research would be helpful in my career goals is that you really do need to, we hear the phrase often, think outside the box, but it really does require us to think of things differently, approach them differently, look at them differently if we're going to get better results. So those being able to research more thoroughly what is actually taking place and asking the appropriate questions, I think will serve me well in my career. The most significant lesson learned, of course, around professional development was the use of statistics as a managerial tool. That is probably the one course that had the most value for me at WGU. Understanding how the statistics are put together, how they can help you to interpret information correctly, how to identify when statistics may be poised in a way to give you a different different information than what is factual. And then really learning to begin with the end in mind. The statement that Stephen Covey mentions in his presentation on the 7 habits of highly effective people. Beginning with the end in mind was really useful in the task 4 project. Understanding what the goal we were headed for was important to know how we wanted to strategize for solving it, and looking and asking the right questions and looking at the data more deeply to answer those questions. And then finally, what will I do to continue? What are the 3 SMART goals that I will establish to continue my professional development? One is to identify 5 performance outcome metrics for our on-site program for my current employer by October 10th, to identify whether how we will measure whether they are doing their job effectively. The on-site team is doing their job effectively. What we will use to manage or measure their performance, to manage their performance. The second is to develop certainly to update my resume with my accomplishment in obtaining my MBA, and then to ask within my current employer, begin a job search for other opportunities that may become available for me with my more in-depth understanding of the business and how to use the tools provided for me through the MBA in that business. And then finally, developing one reporting tool to measure progress each quarter toward the readmission reduction, and develop that tool by September 30th, by the end of September, to help to determine whether this on-site project is actually meeting the goal. Is it reducing readmissions as planned? Thank you for your attention.